We've just organised a night just for all the different groups to get together and share what they do, what their roles are within the refugee community, whether it's either clinical or support, and just so that it's an information sharing evening.
Armidale's the first new regional resettlement location in 11 years, so it's a little bit of a test case, and the idea is trying to pull newly arrived communities out of capital cities and try and rejuvenate regional locations and I guess spread that diversity throughout Australia. A decision was made to just settle one cohort here, and that's to try and hit a bit of a critical mass of a community that's not going to be drawn towards larger communities that already exist elsewhere. Our entire community is Iraqi Yazidi. I think settlement is going very well. The Armidale community is really, really supportive of refugee resettlement here, and that informal support has been really crucial to, I guess, the success of settlement. So the community feels very welcomed here and feel like there is, I guess, a genuine desire for them to be here.
To date, I think we're up to about 500 humanitarian entrants, and a lot of my work is concentrated around that, working with community groups, individuals, families, organisation, to assist them with Australian government payments and services.
We find that what they've gone through in their countries is really affecting the way they are settling in Armidale. So our work is to support them, to help them through those experiences, and so that they can be able to settle in and move on with their lives.
Yeah, so not only they've suffered immense trauma, and they've got a lot of them suffer from significant symptoms of trauma. They've also arriving in a new country where everything's new and where they don't know the language. So there's a lot of challenges for them when they first arrive.
Obviously the language and communication issue is one that all migrants face, so they need healthcare interpreters for all of their interactions really with the healthcare services. For a lot of healthcare providers, it's a skill set they don't necessarily have, how to work with healthcare interpreters. So I think a lot of the GPs and people working in the public health system here have had to learn that skill, how to use face-to-face interpreters when they're available, but also telephone interpreters. The knowledge about health issues that newly arrived refugees may have can sometimes be a challenge. There are things that we screen for that are common in refugee populations that wouldn't be necessarily commonly seen in Australian people, and also working out the best ways to address these is sometimes a challenge. So knowing which kind of medications are accessible and able to be used. So that's some of the background work we've done with healthcare professionals here, and particularly GPs in the community in Armidale. Tonight's forum really is to talk about, I think, where things have gone well and things that we'd obviously like to continue, but also the problems that we're now facing, I guess, with the volume of people coming to Armidale.
Within general practice, we're struggling to manage the number of people in the town just because of our limited rural workforce. We all want very much to make life as wonderful as it possibly can be for the new refugees. So we've asked the PHN to help us with that, which has been fantastic, and that has resulted in this evening, which has absolutely blown me away because the presentations so far have been fabulous. I've learnt new things, which is wonderful. The fact that we have so many people here shows that so many people want to make this right, but that we're also struggling. So this is the first opportunity we've had to really come together, which I'm very pleased about.
Tonight was particularly good because I think getting that medical perspective meshed in with the delivery of services from the other agencies provided a good oversight, and I think it's probably very good for the GPs to see how many agencies are involved in settlement. So it's been a very worthwhile evening, I think.